Hello, and thank you for joining me for another episode of You Would Think. Short background on the case for any new viewers. We're going to be recapping day 11 and 12 of Lindsay Clancy's trial that's going on right now. Lindsay Clancy is the Massachusetts mother who is accused of strangling her 3 young children and then jumping out of her second-story bedroom window 20 feet to the ground, paralyzing herself. Prosecutors allege that Lindsay was not in the throes of any kind of psychosis like the defense alleges, and that she was clear-minded, and at one point in their opening statement, they had their theory, which was she didn't like the life she was living anymore. So she kills her kids and tries to kill herself. I don't know. Make that make sense. But if you've watched my previous videos, then you'll know that I really don't think the prosecution has any idea of what their theory actually is at this point. So, full disclosure, I am not an attorney. I do not have a law degree. My degree is in forensics and crime scene technology. This is a trial channel where we simply discuss and engage in trials. I like to see things from your perspective and have healthy conversations regarding those. True crime and trials have always been a bit of a hobby of mine, so I thought, let's make a YouTube channel, and that way I can share it with you. So here we are. Okay, so in the very beginning of day 11, Kevin Reddington, the defense attorney for Lindsay Clancy, asked the judge if he would allow an additional witness for the defense that would rebut some of the testimony that had already been given in the prior day, day 10, from Aaliyah Goodhart, who worked at the McLean Hospital that Lindsay was apparently admitted to in the early days of January of 2023. Now, remember, this tragedy occurred in January 24th of 2023. So this was essentially the last stop that she had made to get help with her mental health. And the woman reached out to him because she had seen on TikTok a few statements that were made about McLean Hospital as it relates to a skeleton crew, I believe, working on the holidays, because she was there for New Year's Eve. I think that was the point of that whole testimony. And this person apparently said that Dr. testimony wasn't accurate. However, this woman did not work at McLean during the time frame that Lindsay was there, nor does she work there now. So, the defense or the prosecution had, their argument for that was exactly that it's not relevant, because the woman didn't, she reached out on TikTok, for God's sake. I mean, let's keep a shred of dignity to these trials, huh? However, and the judge made some interesting comments as well. He did ask about relevance, and then he also said, this is not TripAdvisor. I thought that was funny. And the prosecution, says, we present fact, not opinion. at which point the judge suggested a voir dire of the witness, which is kind of like a little mini hearing within the trial, just to see what a witness knows and what they're going to testify to. Not much was said about that, but yet again, at the end of the argument, the judge said that he would take the request under advisement. But again, he was, inclined to do a voir dire of the witness. And then we never heard anything about it. So, Dr. Gelada took the stand. And Dr. Gelada was the psychiatric nurse practitioner that took over Lindsay's care when Dr. Julie Paul left the practice. And then her care was just kind of naturally transferred to Dr. Gelada. At least this doctor, unlike the two that we heard from on day 10, Dr. Goodhart and Dr. Tufts, had some specialized training in postpartum. And she would help women up to 2 years of their most recent baby. In her testimony, she also said directly postpartum psychosis, which is something different from the last two mental health counselors. She said that over the past 5 years, she's worked with approximately 5 women with postpartum psychosis. And, the prosecution asked her a lot of questions like, did you have the ability to confer with the community of medical professionals if the patient needed more help? To which she said, yes. Prosecution also asks, did she have the ability to provide medical management? Or not medical management, medication management. Again, to which she said, yes. She said, postpartum usually only stands and starts within the first year. She said all of her appointments with Lindsay were virtual, but that the patient did have the option to schedule in-person appointments. She said that she first met Lindsay in November of 2022, at which point she had reported sleep issues, even with different kinds of medication. And it was at that point that Dr. Gelada prescribes Remeron and Trazodone. So we have another mental health expert in charge of Lindsay's care, kind of just throwing medication at her the way you would throw spaghetti up against a wall to see what sticks, And then as the appointments continued, she did say she noticed that Lindsay was starting to kind of lose weight. So she suggested get more medication. And now we're talking about Ambien and hydroxyzine. Now, I myself, just like I'm sure a lot of you, struggle with some kind of mental health challenges, dealing with anxiety and sleep issues, to maybe something more serious like bipolar or schizophrenia. But speaking for myself, I suffer with anxiety, OCD, and have a really hard time sleeping. I feel like I have to sacrifice my soul just to sleep if I don't have something to help me sleep. And it's not just falling asleep too. It's falling asleep and staying asleep. And throughout this case, a lot of the medications that Lindsay has been prescribed, I actually take myself. Now, I'm painfully aware, that medications affect people differently. You will never have a specific person with a specific medication and it's going to black and white treat them, this way definitively each time. It will always be different. Specific medications are also going to interact with a specific person in its own way, and it's not just the medication. It is how they're taking the medication. Are they taking it as prescribed? Are you giving the medication a valid time to begin working? Some medications take up to 4 to 6 weeks until the person begins to feel better. And now I was fortunate enough to be able to collaborate with my behavioral health doctor and try different things. And with me specifically, it was more so the dosages that we were playing with, more so than the medication. And, just to see what worked. So example, gabapentin. I'm a type 1 diabetic and I have neuropathy in my feet and legs. Now, if you've never had to deal with nerve pain, you had better go and thank whoever it is in the universe that you have to thank that you have not. But we had started with, I believe the dosage was around like 100 milligrams. And before anything started working, we had gotten up to 800 milligrams 4 times a day, which math is about 3,200 milligrams a day. And at those levels, it had begun to work, but it took time. Let me know in the comments your thoughts regarding the medication aspect of this case so far, if you've been following. I would like to know your opinion as well. So something that will be echoed throughout day 11 and day 12 by different providers is that she seemed to be getting prescribed medications like left and right, and none of the doctors seemed to be communicating with one another. However, one constant theme is that Lindsay was afraid of the medication, and she was very hesitant to take certain medications and afraid of getting addicted to them, etc. To the point where she would not take the medicine as prescribed, and if something didn't work, like Remron, which can take the 4 to 6 weeks, if it didn't work after her purported 4 days, she would stop taking it and ask for something different. So she wasn't really giving the medication an adequate time frame to begin working. And so it wasn't just the mental health counselors throwing medication at her. It was seemingly also Lindsay's haphazard way of taking the medication. And if you don't do it the way that you're supposed to, how could you reasonably assume that your mental health struggles are going to get better? So, of course, did they get better? No, they got worse. So that's something that's going to be kind of echoed through a lot of these providers, is that Lindsay wasn't necessarily compliant or willing to be on certain medications for a recommended time period that she needed to be on them. Then, she said some of the signs of psychosis could be things like being distracted, having auditory hallucinations, paranoia, and says that Lindsay was not displaying any psychotic symptoms in November of 2022. Said she had not had any ideations of self-harm or any homicidal ideation. Now, one thing I think is going to be super helpful with Dr. Gelato is that they were communicating often with each other back and forth, almost in like a text thread, but it was through a platform called MyChart, which is like a text messaging platform for doctors and patients to communicate. I use MyChart. It's a very, very helpful tool because it has all of your stuff all in one place, and you can communicate with your providers about prescriptions, just anything, really. And so these communications had continued from November through December 2022. And Lindsay apparently shared that she was having some intrusive thoughts and was not happy with her treatment plan and medication, which is fine, but just remember to, include a person giving the medication time to work and taking it the way they're supposed to. Otherwise, how could you reasonably assume that she would get better? Of course, you won't. You will inevitably get worse, and that is exactly what happened to Lindsay Clancy at this juncture. So, December 6th was the only in-person appointment that Lindsay had had so far with any of the medical professionals that were in charge of her care. And Patrick attended this meeting with her. And if you'll remember, during Patrick's testimony, when he was on the stand, he said that he was also frustrated because Lindsay wasn't getting better. Prosecution then goes through her extensive MyChart messages that stemmed from November to December 2022. Moving on to day 12. Day 12 began with a detective who responded to South Shore Hospital and oversaw the search warrant and was also tasked with keeping custody of the evidence that was collected all the way from the point of collection until it was inventoried. And the defense claims that the detective, police, the DA, they were all communicating with each other. So then he asked if he had collected the cell phones. That was apparently, one was on the bed, one was in a drawer. He asked if he remembered them having blood on them, to which he said he does not recall. After the search warrant, he went to Brigham's Women's Hospital because that's where Lindsay was transferred after a couple days, South Shore Hospital. And at that point, he had, taken custody of Lindsay. Defense talks about how difficult it was for people to see Lindsay there. And even her parents and attorney, not him, but a different attorney, had to get a court order just to see her. The defense established that this detective was heavily involved in all of these proceedings and asked if the psychiatrist, Paul Seidel, that Reddington hired to visit Lindsay, told her to call Pat from his cell phone and tell him that she heard voices, to which there was an immediate objection and then a sidebar. So we'll take a short look at that.
In that hospital, and I mean nobody, right?
Correct.
And this went on for day after day after day, to your knowledge, facilitating, right?
Correct.
Her parents couldn't get in to see her, correct?
I don't believe so.
She had an attorney that had difficulty, not me, but another guy that had difficulty getting in to see her. Isn't that right?
I'm not aware of that difficulty.
I had to get a court order to get a doctor in there to see her, didn't I?
Yes, it was a court order.
And when I got the court order, a doctor came in and met with Lindsay pursuant to that judge's order, and that was Paul Seidel, correct?
I believe that's the name. I'm not sure if he was a doctor, but I believe that was the gentleman that came on the court order.
Okay, only because in your direct you said that he was not a doctor, but he was a psychiatrist. So, I mean, it's just, you knew that he had something to do with head doctor, psychiatrist, psychologist, something like that.
Correct.
Okay. Did he have to clear it with you to get into the room?
He checked in with myself and the other trooper. We were advised that he was coming and to let him in on the court order.
All right. Now, I wasn't there on that occasion, right?
No.
And when Dr. Seidel, or whoever it was, went into the room to see her, it's your memory that he was allowed to shut the door. Is that correct?
I believe he shut the door.
Now, you were involved in this investigation pretty intensely, working with the DA's office, right?
Correct.
Is that Paul Seidel, my doctor, that I got a court order to get in to see her, told her to call Pat and tell him that she heard voices?
Can I see counsel sidebar in regards to this?
So they came back from sidebar, and the judge addresses the jury and excuses them to the jury room for a period of time. And then they had a voir dire of the detective, which, remember, is like a little mini hearing where basically the defense and the prosecution get to ask questions of the witness to find out exactly what the witness knows and what they can testify to before it's done in front of the jury. So some of the questions that the defense was asking was defense's psychiatrist that came in via court order went into the room with Lindsay. Says he doesn't know, he doesn't recall if the door was shut, cracked, anything like that, and asked if he had collaborated with the DA about certain theories. The defense said one theory was that Lindsay called Pat. Apparently was testimony that Pat had given to the DA, and I believe he said the grand jury, that Lindsay called Pat from the psychiatrist's cell phone and told him she was hearing voices, and asked if the detective, the prosecution then asked if the detective had said that he had only ever spoken to one of the troopers in his office about this theory, and he had no memory of talking to the DA. The detective went on to say something that he had already said, and the defense, in awesome Kevin Reddington style, cut him off, apologized for cutting him off, but said, let's cut to the chase. Yeah. And established that the trooper told the detective that Lindsay told Pat on the phone that she heard voices. And when she told Patrick she heard voices, the prosecution determined that the psychiatrist had told her to say that to establish some kind of defense, right? Question mark? And to which he said he did not recall, but agreed that that was, in fact, a theory that was discussed. Then the prosecution got up, argued the detective did not hear anything, and never had a conversation with the prosecution about the case. They asked the detective if his memory had changed after having had that conversation with the trooper, to which he said no. And in fact, they say, all you know factually is who the conversation was with, Pat, and what Lindsay told him, that he was hearing voices, or that she was hearing voices from Pat's testimony, correct? And he said yes. Then they took a 10-minute break, and no doubt for the judge to consider what testimony he was going to allow. And then when they came back from the break, when trial resumed, cross-examination resumed, and Kevin Reddington was allowed to say that another trooper, and the detective were communicating with him about the case, and they were communicating a theory that stated the psychiatrist was the one that planted the idea in her head about the voices. And he says, correct. Next witness was a perinatal clinician named Letitia Dukes. At the time, she worked at the South Shore Clinic as a mental health counselor and perinatal clinic clinician. She says her duties were to assess the patient's mental health history and how they're presenting now, as well as a risk assessment. She also said that her appointments were usually between 30 minutes to an hour. After that, we heard from two separate medical examiners who detailed the injuries to Cora, who was 5 years old, and Dawson, who was 3. During this testimony of the first medical examiner, Dr. Stonebridge, Lindsay began sobbing so loud the judge had to stop the proceedings multiple times and take multiple recesses and sends the jury into the jury room and wheels her out of the courtroom. Then, when testimony resumed, the judge seemingly allowed this display to continue because she had her head down on the table and was sobbing throughout the rest of that medical examiner and the second medical examiner's testimony. The second medical examiner was Dr. Olson. I think that they were just trying to play it safe because if she passed a threshold with the emotion in front of the jury, that the judge would then do something about it. But I don't know. I've never, in another trial I've watched, I have never seen the judge allow that level of emotion to be shown by anyone in front of the jury. But I think that, the judge is just kind of trying to play it safe, like I said. It's just my personal opinion. I don't necessarily think that it was fair. But there again, I'm not an attorney. I am just a spectator. So, and at a couple points during one of the medical examiner's testimony, the prosecution was doing what they do best, right? And eliciting a lot of unnecessary details from the witness and trying to cause emotion or anger in the jury. And Kevin Reddington objected numerous times throughout this testimony to some of their questions, while his client sat there sobbing right next to him. The defense declined to cross-examine either medical examiner. So we will watch a short video on that.
And how long can it take, or does it take, for loss of consciousness to happen?
I cannot put a specific time on it for the interval. There's multiple variables to consider in a case-by-case basis. The type of ligature used, the force of the ligature used against the neck, as well as the intensity and duration of the altercation. However, in situations where there's complete oxygen deprivation, loss of consciousness can occur as early as 10 to 30 seconds, with brain damage beginning at the 1 minute mark and irreversible brain damage and subsequent death occurring around as early as 5 minutes, again with the caveat that there are variables that might accelerate or decelerate that time frame.
Is there a type of constant pressure that's required to cause that loss of consciousness?
Ultimately, once the brain has a critically low level of oxygen, a loss of consciousness will occur. It takes an average of 4 pounds to compress the veins of the neck and an average of around 10 pounds to compress the arteries of the neck.
And so if someone's squeezing something or pulling something around the neck at that 4 pounds or 10 pounds of pressure in a consistent basis without any resistance, does unconsciousness happen faster?
It could occur faster, yes.
What if someone's resisting or struggling or pulling away? Could that take longer?
When the body is in a state of stress, you have a stress response that demands an actual increase in oxygen utilization by our body. So in the presence of an increased demand with a decreased amount being delivered to the brain, it can accelerate the timeline to loss of consciousness.
What do you mean by accelerate the time to loss of consciousness?
It's obvious what she means.
No, overall, you can ask.
It would just make it occur faster.
And so if that pressure isn't constant, say someone struggles and is able to get free a little bit, and then you have to tighten it again, does that make it take longer?
Sustained.
You said anywhere from 5 to 30 seconds. What are the factors? I'm sorry, you said 10 to 30 seconds. Is that correct?
Yes, for loss of consciousness.
What are the factors that are at play for whether it's 10 seconds or 30 seconds?
Again, there's multiple variables. So the force of the ligature against the neck, the actual ligature itself, and the intensity and duration of the altercation.
And once someone loses consciousness, do they immediately die?
No. So if there's no intervention, the brain continues to have a lack of oxygen. And so until the brain cells start to die, it's irreversible injury to the brain. The person is alive until the body can no longer sustain the lack of oxygen.
If someone is strangled to the point of unconsciousness and the strangulation stops, can they wake up?
Without intervention is very unlikely.
So do you recall testifying previously that when asked if a person were to use a ligature around someone's neck to the point where they pass out?
But, counsel, we've had that answer, right?
It's an inconsistent statement.
This is your witness.
I know, and I can impeach with an inconsistent statement.
I see it's sidebar.
No. Once the brain is subject to oxygen deprivation and brain cells start to die, it's irreversible, and so it will continue to progress towards death if there's no intervention.
What do you mean by intervention?
Resuscitative efforts, if somebody tried to give CPR, if they were hooked up to oxygen machines.
Do you recall testifying previously that it would be your opinion that pressure would need to be continually applied even after losing consciousness to cause death?
Sustained.
If
Hold on. Sustained. Next question.
So that is a short recap of day 11 and 12. Thank you so much for joining me. Remember to put your questions and comments in the comment section. And please like and subscribe. And I will see you next time for another episode of You Would Think. Have a great night.